So hello friends, welcome to my new video. So today I will discuss with you all about papilloedema. So papilloedema, simply saying, it is the swelling of the optic disc due to raised intracranial pressure. So we can say papilloedema cannot exist without high intracranial pressure, but high intracranial pressure can exist without having papilloedema. So if you get a patient who is having papilloedema, then he may be in the risk of developing brain tumor, cerebral edema, or cerebrospinal inflammation, idiopathic intracranial inflammation, all those things. So before going to tell you about the etiology behind the raised intracranial pressure, I would like to tell you a important factor that is responsible for maintaining the normal, what to say, intracranial pressure, that is Monocali doctrine. So it is the pressure and volume relationship between cerebrospinal fluid, blood, brain tissue and cerebral perfusion pressure. So increase in any of the component will lead to decrease in other two component, or otherwise increase in any of the component will lead to rise intracranial pressure. Okay, suppose there is increase in total amount of intracranial tissue due to mass lesion growth will lead to rise intracranial pressure. Why? Because there is a fixed amount of CSF, fixed amount of brain tissue, or there is a fixed amount of cerebral perfusion pressure is there. So growth of an extra mass lesion will lead to rise of intracranial pressure. On the other hand, if I tell you that increase in the volume of uh, brain tissue due to cerebral edema can also lead to rise in intracranial pressure. Otherwise, increase in the production of cerebrospinal fluid or decrease in the outflow within the ventricular system of cerebrospinal fluid can also lead to rise of intracranial pressure. Okay, so these are some factors that is responsible for elevation of intracranial pressure. So how this intracranial pressure increase will lead to disturbed vision. Okay, so the main mechanism is exoplasmic flow stasis. So due to the high intracranial pressure, it lead to disturbance between the pressure gradient between the intraocular pressure and retrolaminar pressure. So this is the prelaminar region, this is the lamina cribrosa, and this is the retrolaminar area. So there is a normal pressure gradient between intraocular pressure and intracranial pressure that is faced by this retrolaminar region. So increase in the intracranial pressure will lead to more pressure in this region, that will lead to increased tissue pressure on the nerve. So increased tissue pressure on the nerve will lead to interruption of metabolic process of normal exoplasmic flow, that will lead to swelling of the optic disc. So acute papilloedema will lead to large optic disc in HVF. So if you send the patient for HVF, then you will see large optic disc in case of papilloedema cases, right? So it lead to damage to the nerve fiber layer, leading to peripheral field defect, but spare the papillomacular bundle, so central vision is spared until the late stages coming, right? So that's why central vision is spared, but the patient case can say that he is having disturbed peripheral vision, right? So he will see like that, where peripheral vision is actually disturbed, but due to the sparing of papillomacular bundle, the central vision is spared. Okay, so these are the causes of rise intracranial pressure, where intracranial mass lesion growth that I told you, or hemorrhages due to any trauma, right? Anoxia, thickening of the skull. So thickening of the skull will lead to constriction of the brain tissue, blood, and cerebral perfusion pressure, all those things. So it will ultimately leading to rise of intracranial pressure. Okay, or elevated cerebral venous sinus pressure, or increased CSF production, or decreased CSF outflow will also lead to rise of intracranial pressure. So this is the workup protocol for papilloedema cases, where you need to focus on the history taking very nicely, where you need to ask to the patient about the visual field defect, right? Say, like the nerve fiber layer is getting damaged, so that's why you need to ask to the patient whether peripheral vision is affected or not. Then you can ask to the patient about diplopia, headache, nausea, vomiting tendency, and also you need to ask to the patient about the steroid medication taking history, or tetracycline oral contraceptive, or You can also ask to the patient about the weight gain or obesity, because obese people are getting more prone to develop this papilloedema cases. Or optic disc evaluation is very much important in this type of cases, because until unless you don't do optic disc evaluation, then the sure diagnostics will not be possible. So that's why disc evaluation is very much important. So these are the grades of papilloedema, where it start from grade 0 and finish at grade 5. So grade 0, here the retinal nerve fiber striations only seen, but rest everything within normal limit. So here it is not that much detectable in grade 0, but if it is in the grade 1, then it is leading to obscuration. So here obscuration means blurring, right? Obscuration of nasal border with normal temporal disc margin, and no elevation of the disc is noted. Here disruption of nerve fiber layer start in this grade 1. And if I talk about the grade 2, then in grade 2 obscuration of all borders with elevated nasal border can be seen, and here in this stage also no vessel obscuration is seen, right? And in grade 3, here obscuration and elevation of all borders, and it is more severe than grade 2, and obscuration of one or more segments of the blood vessel also start in this phase. Then if I talk about the grade 4, here complete obscuration of all borders with more severe than grade 3, and obscuration of major segment of the blood vessel can be seen in grade 4. And in grade 5 you will see total obscuration of all vessel, leaving the optic disc is there. So this is the very severe condition where grade 5 is there. There is the ultimate stage. Okay. Now, if you are suspecting that the patient may have papilloedema, then you need to send the patient for these following investigations. First of all, you need to send the patient for brain MRI. Then lumbar puncture also very much helpful for detecting papilloedema cases, where CSF sample is taken from the lumbar area and examined in laboratory. You can also send the patient for field defect is there or not, to see whether the optic disc is getting enlarged or not, to see what is the severity. Then you can also send the patient for FFA and B scan for disc evaluation. Okay, so here this is the OCT RNFL report of a papilloedema case. So now basically we send the OCT RNFL report in case of glaucoma, where you all know that until there is 40% damage to the retinal ganglion cell, there is no field defect happen. So that's why if you are suspecting that the person is actually having glaucoma, then you need to send the patient for OCT RNA for the disc evaluation properly, to diagnose early stages glaucoma, that is also known as pre-perimetric glaucoma, right? But in case of papilloedema cases also, if you send the patient for OCT RNFL, then you will see the following findings. So here in this picture you can see no normal butterfly pattern is there, where in my previous video I already told you that the warm color indicate thickness and cool color indicate thinning. So here butterfly pattern can be seen in this area, but this area is showing abnormal pattern. Okay, and here around the optic, this red color is surrounding, it is indicating some thickening is there in this area. Why? It is because of the papilloedema. So if you follow this RNFL thickness map or TSNET map, you will see the elevation of left eye thickness in this region. So this is quite abnormal report that we see in case of OCT RNFL. Now this is the more severe papilloedema case where OCT RNFL was performed, where you can see the signal strength is 8 by 10, so it's quite reliable. So here you can see that uh, the around the disc there is severe disc swelling is there. Okay, and in the TSNET map also you can see there is the continuous line indicating the right eye and dotted line indicating the left eye. So these lines are get elevated very much. Okay, that is indicating, yes, there is very severe edema, there is a severe swelling is there in the optic disc area. Okay, now in this picture also it is the similar thing happening, that due to the extreme swelling of the optic disc, it is leading to very much elevated thickness in this area. So it is very much abnormal thing so that's why you can also send the patient for OCT RNA for the proper documentation of this optic disc finding, right? So here, what is the management for this papilloedema? So the management is treat the cause to treat the papilloedema. That's all. That's all. Thank you so much, and thank you for watching this video, and please don't forget to like my video and subscribe to my channel. Thank you so much.